And we are joined once again on the programme by the Vaccines Minister, Nadhim Zahawi. Mr Zahawi, really good to see you this morning. And it does feel, having dipped my toe into social media this morning, seen some concern, seen plenty of misinformation, it feels like we all need to take a few deep breaths this morning because we are talking about vaccinating children. Can you just repeat the justification that was given to the public yesterday by the Chief Medical Officer? Why do we feel it is necessary for 12 to 15-year-olds to receive a vaccine?
Yes, absolutely. Good morning, Neil. So the Joint Committee on Vaccination and Immunisation, who have relied upon and have delivered throughout the vaccine deployment programme, I've been on your show many times, beginning back last year when we launched with the Pfizer-BioNTech vaccine on the 8th of December. The JCVI looked at the clinical impact on 12 to 15-year-olds and came down on the side that actually being vaccinated is marginally better, but not enough to recommend a universal vaccination programme. They recommended that the chief medical officers of England, Wales, Scotland, Northern Ireland look at the other public health and mental health impacts on children, not on the wider population, on those 12 to 15-year-olds. They reported yesterday, and they've unanimously, all four chief medical officers, England, Scotland, Wales, and Northern Ireland, have recommended that we offer a one dose of the Pfizer-BioNTech vaccine to 12 to 15-year-olds. Now, the way we will do that is, and we've accepted that advice, is through the school-age immunisation service, which has been doing vaccination of children for many, many years, very well versed in doing this. So clinicians will lead on this in schools. Schools will contact parents in the usual way that they do and will require consent, parental consent. Of course, this is voluntary. There is no stigmatization of any parent or anyone who may choose not to have the vaccine. Although I have to say, when we offered the vaccine last month to 16 and 17-year-olds, they came forward in the past month in their droves, in their numbers, because they realized how important it is to protect themselves. And of course, they've seen firsthand the damage that the COVID pandemic has done to mental health and, of course, to schools as well.
But just to go back to the rationale for this, part of the concern, as I understand it, from parents who've expressed concern, is that we have, in essence, clinical advice being given for non-clinical purposes. We have doctors advising 12 to 15-year-olds to follow a medical process, a vaccination, for reasons which don't seem to have a grounding in the clinical side. And that's worrying people.
And that's really important to sort of try and flesh out for your viewers. The chief medical officers were asked, the JCVI, the Joint Committee, actually recommended that we ask the chief medical officers. We asked them. They also consulted with the Royal Colleges of Paediatrics, the Royal College of GPs, and of course, the JCVI were in the room to look at the mental health impact on those 12 to 15-year-olds, the public health impact on the 12 to 15-year-olds, not on the greater sort of good of society. It's actually for those 12 to 15-year-olds. The JCVI were only sort of looking at what they are narrowly qualified to look at, which is why they made the recommendation that we should also ask the chief medical officers. They have now come back to us and they recommend the offer of a single dose for 12 to 15-year-olds with parental consent. So that is what we'll be going ahead and doing. It's been a very thorough
Just on the consent point, sorry. Just on the consent point, Minister, we've really got a finite amount of time this morning. I'm really keen to kind of get through as many questions as possible. But on the consent point, how will that be administered? Again, of course, a bit of disinformation on social media this morning. I mean, isn't it the case that 12 to 15-year-olds can, right now, consent to other forms of medical treatment where their parents perhaps have a different view?
So the consent process, the school-age immunisation service, are really well equipped to do this. They've been doing it for years for children's vaccination in schools. So children will have a leaflet that they can share with their parents, and of course will have a consent form that will go to them either electronically or in some schools physically to their parents, and the parents will then read all the information, have to give consent if the child is to be vaccinated. On the very rare occasions where there is a difference of opinion between the parent and the 12 to 15-year-old, where the parent, for example, doesn't want to give consent, but the 12 to 15-year-old wants to have the vaccine, then the first step is the clinician of the school immunization service will bring the parent and the 12 to 15-year-old, the child, together to see whether they can reach consent. If that is not possible, then if the child is deemed to be competent, and this has been around since the 80s for all vaccination programs, for example, in schools, if the child is deemed to be competent, the Gillick competence, as it's referred to, then the child can have the vaccine. But these are very rare occasions, and it is very important to remember that the school age immunization service is incredibly well equipped to deal with this. Clinicians are very well versed in delivering vaccinations to 12, 15-year-olds in schools.
Sure. Let's talk, though, about the winter plan. And this was something we explored with your colleague, Therese Coffey, yesterday. It is absolutely fair to say, isn't it, that despite the clear inclination to avoid lockdowns, to avoid reintroduction of mandatory face masks, social distancing and so on, clearly you don't want to do it. But those options remain in the arsenal, don't they?
So the non-pharmaceutical interventions, the NPIs, the dreaded NPIs, were our only weapon against the virus before the vaccines came along. The vaccines now are sort of the prime way we have been able to manage this virus, and will continue to be, as the Prime Minister will set out later today, as will the Secretary of State make a statement to Parliament. They will
Sure. But let's, again, we're really pushed for time. Lockdown remains an option, doesn't it? Social distancing, mask wearing, it all remains an option. It's just because the Prime Minister will be saying, the pandemic is far from over, but, we are able to live with the virus without significant restrictions on our freedoms. I'm just wondering where the tipping point is that would lead to, for example, lockdown being brought back in and so on.
So lockdowns would be an absolutely last resort. What we're trying to do at the moment, Neil, is to transition this virus from pandemic to endemic through a massive vaccination program. We know the vaccines have saved over 112,000 lives, 24 million infections. We're about to embark on a massive booster campaign and, of course, a flu vaccination program, because I am concerned about flu. We haven't had much flu circulating anywhere in the world. And in a bad year, we could lose up to 25,000 people to flu. So the combination of the booster campaign for COVID, which the Prime Minister will say more about today, as will the Secretary of State, in terms of the JCVI final advice, which we have now received and have accepted. The interim advice, which they gave us on the 30th of June, helped us to plan. So planning has been well underway to be able to, I hope, come back on your program and break the record that we set in the first vaccination program, because we have a massive task ahead to effectively protect the most vulnerable with a third booster shot, as well as, of course, we're already doing the immunosuppressed as part of their primary vaccine treatment.
Sure. Sorry, Minister, but the reason I push on this is at times this week it does feel like the messaging from government has been in different places. At the weekend, that's an end. No vaccine passports. The following day, we find out that they remain on the table, telling the Prime Minister incredibly optimistic, but at the same time suggesting that there are circumstances in which, as you've just conceded, we could go back into lockdown. I mean, it's a little bit early in the year to be asking these kind of questions. I will concede. But you can't, for example, guarantee right now that we'll all be able to spend Christmas with our families, can you?
So, look, the important thing to remember is as we embark on the winter months, the virus have an inbuilt advantage, whether it be flu or the COVID virus. As Chris Whitty set out yesterday, it would be foolhardy to suggest that this thing is already transitioned from pandemic to endemic. That is the direction that we're taking. A massive booster campaign, a really fit-for-purpose variant surveillance system, a really fit-for-purpose test and trace system. That is where we think we will be able to end up. We're confident that we have the infrastructure in place to deliver on this. But of course, look, we have to have contingency planning. There is, all the time, more information coming in on how the virus is behaving. Winter has gives the virus an inbuilt advantage. Boosters reduce that advantage by, hopefully taking the most vulnerable out of the harm's way of the virus.
I understand all that. I understand all that, Minister. I'm really not looking for some kind of gotcha moment here. All I'm trying to kind of flesh out is the idea that we are not out of the woods in terms of COVID. Even if things go as well as you expect, there remains the possibility, however likely or unlikely, that we could see ourselves returning to, public health responses, the likes of which we have seen, in the recent past.
So again, I just repeat for your viewers, the non-pharmaceutical interventions, the lockdowns, were our only tool. That is no longer true. That we have the vaccines, we have the test and trace system, we have the surveillance, the variant surveillance system, we have the public health advice, which people followed of all ages, really, really diligently, which has allowed us to take step forward to reopen our economy. And the booster campaign with flu will help basically protect the most vulnerable as we transition, I hope, this virus. And I can come back on your program and say to you, after winter's over, hand on heart, we are one of the leading major economies of the world to demonstrate how you transition the virus from pandemic to endemic and then deal with it on an annual basis through the inoculation, the vaccination program.
We will all be keeping our fingers crossed that is the case. I do wonder, though, what your advice would be to colleagues within your party who are openly expressing scepticism about one key aspect of all of this, the vaccination of 12 to 15-year-olds. Marcus Fish tweeted this: "Sorry to have to say it, but the Chief Medical Officer, Chris Whitty, does not deserve the confidence of the country in deciding to vaccinate teenagers without good clinical reason." His words, he, the Chief Medical Officer, should resign. What would you say to Mr. Fish this morning?
Well, all I would say is that both the JCVI, who in their guidance said, look, it is marginally more beneficial to be vaccinated, the 12 to 15, healthy 12 to 15-year-olds. It's well worth reminding your audience that we've been vaccinating 12 to 15-year-olds who are more vulnerable as per the JCVI advice. The JCVI advice also said that we should consult the 4 chief medical officers, and they have unanimously come back. This is not just Chris Whitty. This is all 4 chief medical officers of England, Scotland, Wales, and Northern Ireland to give us the advice that we should make the vaccine available to 12 to 15-year-olds who are healthy and for their parents to consent. And that is exactly what we will be doing.
A good point on which to conclude. Minister, good to see you this morning. Thanks for being with us.